And so I am very excited for you all to see how ASIF, or the Axial Spondylo International Foundation, is attempting to attack delay in diagnosis as well. So let's go ahead and watch these amazing videos, and I will be back afterwards.
Axial spondyloarthritis, also referred to as ankylosing spondylitis or morbus Bechterew, is a painful, chronic inflammatory disease that causes pain and stiffness in the spine and sacroiliac joints. As many as 1 in every 150 people worldwide have axial spondyloarthritis or AxSpA, and it affects men and women equally. The disease can first occur at any age, but typically begins between the ages of 20 to 40. There is currently no cure, so the disease is lifelong. Lower back pain, sometimes with hip or buttock pain, is usually the first sign of AxSpA. People also experience excessive stiffness. The pain and stiffness are often worse at night. Both get better with movement, but worsen with rest. It is also common for people to experience extreme fatigue. In most cases, the pain and stiffness start slowly and appear gradually over weeks or months. People can experience days or weeks of very bad pain, but also periods of hardly any pain. Some people may experience symptoms in other areas of the body, even without significant back pain. These can include peripheral arthritis, which is inflammation and pain in other joints, often the wrists, ankles, elbows, and knees. Enthesitis, which is the swelling of the point where ligaments attach to bones. It often causes pain in the heels and knees. Inflammatory bowel disease, a disease that causes pain and inflammation in the intestines. Uveitis, which is pain and inflammation in the eye and can cause changes in vision. Psoriasis, a condition where patches of the skin become scaly and inflamed, most commonly on the scalp, elbows, or knees. Early diagnosis is vital to make sure people get the best treatment. Without the right treatment, the disease can get worse and cause permanent disability. People with suspected symptoms of AxSpA should see their doctor urgently, where they can be assessed and referred to a rheumatologist if needed. For more information about axial spondyloarthritis and the issues raised in this film, please visit www.asif.info or follow us on social media. You can find details of your nearest local patient organization on the ASIF website.
The symptoms that I have experienced in the early stages of AxSpA was really stiffness during mornings, back pain that was getting better when I was active, like walking, jogging, playing sports, and it took more than 3 months, and it didn't get away.
The pain, the lower back from my right hand side, and the leg, which is also the right hand side, but the knee and the bum, because it was going through like from the lower back to the bum to the heel as well.
I have difficulty moving my lower back, and there's also difficulty with what I love to do, like dancing.
So I was first diagnosed with AxSpA in my final year at college. So I was actually around 24 or 25. The main symptoms when it started were the hip and buttock pain.
I was 18, 19 years of old when the first symptoms kicked in. I was doing basketball, I was doing football, I was doing tennis, I was doing also, I was very active teenager, very active kid. And at that point of time when pain and inflammation started, I didn't know what's happening to me.
The day when I got that diagnosis, there was a bit of frustration and some anger added to that, to say all these years that I've been in bed, in hospital, not being able to do anything for myself, It's only now that I could find out that I have this.
So those years that I having these difficulties, those years that I'm having those struggles, this is now has a name. Recently, I had this experience with a couple of friends that we went to see during the holidays. And he was surprised to see me. I told him, this is now what I am. I can barely look on my left or on my right.
So, from just a psychological point of view, when your body starts changing, the whole life is changing.
If I wanted to advise my younger self, I would say try harder to find the form of exercise that you love, and then you'll do it.
The partnership that you will generate or create with your doctor is very important.
Reach out to the support that we now have, which is making a lot of difference. Just knowing somebody has the same disease, and live your life fully, because even if you have AxSpA, you still have a life to live. I think 7 years. I would say 7 years.
8 years.
6 or 7 years, I think.
12 years.
Wonder what these numbers mean? This is the typical number of years it takes for someone with axial spondyloarthritis to get a diagnosis. It is a chronic inflammatory disease that causes pain and stiffness in the spine and sacroiliac joints, but it can affect other parts of the body, including knees, hands, wrists, ankles. It tends to present in people's early 20s and 30s, and it can be a progressive condition for patients as well. Axial spondyloarthritis is an umbrella term that has two broad classifications. We have radiographic axial spondyloarthritis, which was formerly known as ankylosing spondylitis, and here patients have changes that are already visible on x-rays of the spine and sacroiliac joints. In the other classification, which is non-radiographic axial spondyloarthritis, x-rays are frequently normal, but the changes are predominantly seen on the MRI scan of both the spine and sacroiliac joints. The main symptoms of axial spondyloarthritis are this concept of inflammatory back pain. What I mean by that is early morning stiffness that lasts over half an hour, but can last up to a few hours. The back symptoms are typically better with activity. They tend to be worse with rest. They cause buttock pain that can alternate from side to side, and again, typically will cause wakening in the second half of the night.
When you wake up, the first 30 minutes in your daily routine, your morning routine, it's a little bit more difficult than from the rest of the day when you're just being active and so on.
Okay, the first one would be the lower back, and then the second one would be the knee that will get swollen, and the hands as well would get swollen.
The main symptoms when it started were the hip and buttock pain.
There is already a stiffness in my lower back, the difficulty of getting up from bed in the morning.
The fatigue levels that patients experience with this condition are really high. Along with this, the condition, when it progresses, can obviously lead to spinal fusion. We also have to remember that patients can have had eye conditions such as anterior uveitis, skin conditions such as psoriasis, and bowel conditions such as Crohn's disease and ulcerative colitis. So it's really ensuring that we pick up all the clues that these patients can present with, and putting these clues together really will help us reach the diagnosis much quicker. Axial spondyloarthritis can present like many other conditions, and it's due to the non-specific presentation that can lead to a significant delay in diagnosis.
We were like diagnosed 6, 7, 8 years, delay in the diagnosis, and by then the damages are already done.
Recognizing the condition early and getting those patients referred onto a rheumatologist for consideration of treatments we know that can make a difference now, like the biologic and targeted synthetic disease-modifying drugs, mean that we can prevent a lot of that disability and prevent a lot of that burden of disease and allow people to live.
Alrighty, so let me make sure that we have the next segment queued up. But I wanted to go ahead and recognize that it is also Axial Spondyloarthritis Awareness Month this month. World AS Day was earlier this month. We had a booth at the SAA, or the Spondylitis Association of America's educational conference that they had for World AS Day, and that they have every year. So thank you so much to SAA for having us there. Thank you so much for ASIF for providing us with these amazing resources. Those interviews that they had are really they're really captivating. They really are able to talk and kind of portray how it is to live with AxSpA, and I'm sure that a lot of us can relate to some of the sentiments, no matter if we have AxSpA or not. But yes, so I acknowledged earlier that it was Mental Health Awareness Month. It is also Axial Spondyloarthritis Awareness Month, and just to sprinkle it in, it's also Lupus Awareness Month. So shout out to all of the different awareness days and awareness months that are going on this month. There are a few more as well. They mentioned that Crohn's and ulcerative colitis can be a comorbidity of axial spondyloarthritis, and it's actually World IBD Day today, which is inflammatory bowel disease. So so many different things going on with all of our diseases. So just wanted to put that out there.